It's 133 days into this session of Congress, 113th Congress, 133 days, and we haven't had a single vote on a jobs bill. That's what the American people want us to do, create jobs. It's the answer to so many challenges in their lives. Instead, we're wasting time once again on the Republican repeal of the patient's rights. This is something that is stunning, because not only is it a waste of time, it's a waste of money, over $52 million calculated to the cost of taking of this bill over and over again, which they know is going nowhere. And again, it's not only a vote that is a waste of time, it is a vote to take away affordable quality benefits that the American people are enjoying right now. You have our handout of all of the benefits that are in existence right now. We'll be talking about them some more, but it's about how it affects women specifically that we're talking about today. But those women are part of the nearly 13 million Americans benefiting from $1.1 billion in rebates from health insurance companies last summer. You see the free preventive services like cancer screening, well women's test, coverage for young adults and children with pre-existing conditions. Women no longer pay higher premiums for the same coverage, and being a woman is no longer a pre-existing medical condition. This is a big deal. Our champion on this subject is Congresswoman Rosa DeLauro, who will speak more on this subject. But I seem to have some kind of a condition, so I'm going to excuse myself shortly to deal with that, and then to welcome Congresswoman Rosa DeLauro to talk about women in health, Congresswoman Velasquez to talk about small business and women, Congresswoman Capps, a healthcare provider herself, who knows firsthand how good the opportunities are now, how much better they'll be in 2014, how dangerous the bill is the Republicans are putting forth. Congresswoman Kelly, our newest member of Congress on the House side, and for the moment still the newest member, right? Mm-hmm. For the moment, talk to us about how senior women are affected. We're also joined by Congresswoman Suzanne Bonamici. We're very proud that she is here. Congresswoman Jan Schakowsky from Illinois. And Jan, she's in two places at once. I just left you across the table on another issue. Congresswoman Janice Hahn of California. With that, I'm pleased to yield to Congresswoman DeLauro. Thank you.
Thank you very much, Madam Leader. I'm told lemon and honey will do the trick. They've given you all kinds of...
During the President's inauguration, some of the biggest stars, rock stars in the world were there. And I had advice from all of them. Some of it contradictory. Honey and lemon. Honey, no lemon. Lemon, no honey. No hot water. But the only thing they agreed on it, don't use your voice.
Right. Hear, 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 hear. Thank you, Madam Leader, and thank you for your leadership on this issue. I want to tell you how proud I am to be with all of my colleagues here today. Let me first just say to you, welcome to Groundhog Day. This is the 37th time that the majority has attempted to repeal the Affordable Care Act. We face serious challenges in America. High unemployment, families struggling, a fragile economic recovery. But instead of working together to move forward, this majority persists in relitigating the health care fight of 2010. They need to face it. Health care reform was passed by the House of Representatives. It was passed by the U.S. Senate. It was signed by the President. It was upheld by the Supreme Court. It is the law of the land. But the majority focuses on a package of bills to create jobs. Are they doing that? No. What they want to do is repeal the Affordable Care Act once again. And if the House majority ever succeeded in rolling back the Affordable Care Act, it is the women of America who would be especially harmed. Mm-hmm. American women have the most to lose. And that is because the Affordable Care Act has been transformative for women's health. Let me tell you what would happen if it is repealed. Insurance companies allowed to charge women more for the same coverage as men once again. They could withhold coverage from women who have had a child or a C-section or who have been victims of domestic violence. Coverage for maternity care could erode. Support to help working families buy insurance would dry up. And women would lose access to free, recommended preventive services and screenings that save lives. The wellness exams and an essential benefit package that guarantees better quality health care and, yes, a better quality of life. I know something about prevention. 27 years ago, this March, I was diagnosed with ovarian cancer. I am a cancer survivor. My cancer was detected by chance in stage 1, and I have been cancer-free now for 27 years. I am only here because of the grace of God and the early detection, because I had access to quality health care. No one should survive by luck. Every woman who was diagnosed with a life-threatening disease should have access to care. And by repealing the health care law, the House majority would deny millions of women that same access that I had. This will cost lives. When we're here today, we're not talking about roads, bridges, or parks that we deal with on a regular basis. We are talking about saving lives. We fought hard 3 years ago to be able to put at last women's health on an equal footing with that of her spouse, her son, or her brother. We need to build on that and not turn back the clock. No more partisan games. Women's health, their lives are too precious. Thank you. It's now my pleasure really to introduce our colleague Nydia Velasquez from New York talking about small business.
Thank you. And Madam Leader, thank you so much for focusing on such an important